Hey folks, Dr. Malika Kefi here. Today I want to talk about a critical topic: managing sepsis in the emergency department. Early recognition and prompt treatment can be life-saving, so let's dive into the key steps you need to know. First off, early recognition and risk stratification are crucial. Use clinical tools like the National Early Warning Score, or NEWS, the Sequential Organ Failure Assessment, or SOFA, or Quick SOFA to identify patients at risk for sepsis. Pay attention to signs like an altered mental state, elevated heart rate, respiratory rate, fever, or hypothermia. Once you suspect sepsis, an initial assessment and continuous monitoring are essential. Conduct a thorough face-to-face evaluation, checking vital signs like temperature, pulse, respiratory rate, blood pressure, and oxygen saturation. Also, measure lactate levels within 3 hours of presentation. If the initial levels are greater than 2 mmol/L, repeat the test to monitor changes. Now let's talk about immediate interventions. Administer broad-spectrum intravenous antibiotics within 1 hour for patients with suspected sepsis or septic shock. Remember to obtain blood cultures before giving antibiotics to identify the causative organism. This step is crucial for targeted treatment later on. Fluid resuscitation is the next vital step. Give a crystalloid fluid bolus at 30 ml per kilogram within the first 3 hours if there's evidence of hypoperfusion, such as low urine output or elevated lactate levels. If the patient remains hypotensive after fluid resuscitation, initiate vasopressor therapy. Norepinephrine is the first-line agent here, aiming to maintain a mean arterial pressure of 65 mmHg or greater. Consider advanced monitoring and support measures, especially in cases of septic shock. This might include central venous pressure and oxygen saturation monitoring. For patients requiring prolonged vasopressor therapy, consider using intravenous hydrocortisone, and always continuously reassess and adjust treatment based on how the patient responds. Let's not forget about the importance of education and training. Ensure that all healthcare professionals are well trained to recognize and manage sepsis effectively. Use guidelines to inform clinical decisions, and keep updating your knowledge to provide the best care possible. In summary, timely intervention, standardized assessment tools, and continuous reassessment are the keys to effective sepsis management in the emergency department. Remember, your quick actions can save lives. If you found this video helpful, please like, share, and subscribe. This is Dr. Malika Kefi signing off. Stay informed and keep saving lives.